Namaste. I am Dr. Revati, Healthcare Advisor at VIAMS, Dr. K.V. Vijayan Institute of Ayurveda Medical Science Private Limited. Welcome one and all for today's webinar, VIAMS Approach on Parkinson's Disease Management. In today's webinar, we will be discussing about the opportunity of Parkinson's disease management based on Ayurveda. April is Parkinson's Awareness Month, and today, April 11th, is World Parkinson's Day. On behalf of World Parkinson's Day, we, as the pioneers in caregivers for Parkinson's disease, wish to spread awareness and treatment possibilities of Parkinson's disease. VIAMS is an Ayurveda-based healthcare organization, and it's our responsibility to propagate Ayurveda globally and create awareness in as many people as possible. We can control Parkinson's with Ayurveda to improve the quality of life of people affected by Parkinson's disease. We should look into the importance of Ayurveda. Ayurveda is the wisdom of life. It has been practiced in Indian region for more than 5,000 years ago and is often called as the mother of all healing. It is not just a medical system for human. The wisdom assures health and well-being of all living beings. Ayurveda assures holistic health and cure of ailments. Ayurvedic principles are based on 5 basic elements, Panchamahabhutas: space, air, fire, water, and earth, which manifest in the human body as Tridoshas, Vata, Pitta, and Kapha. Each person is born with a unique combination of Tridoshas, which decides their basic constitution called Prakriti. We all have a different balance of energy. Ayurveda shows that the path to optimal health is different for each person depending upon their body constitution. Ayurveda envisions to maintain and improve the quality of life by Dinacharya, the individualized specific daily regimen, Ritucharya, seasonal regimen, Sadvritta, behavioral and ethical considerations, which itself is a healthy lifestyle to emphasize and determine the longevity of life. VIAMS places great emphasis on prevention of diseases and encourages the maintenance of health through close attention to balance in one's life, right thinking, diet, lifestyle, and the use of right medications. I would like to introduce our team who are participating in today's webinar. Dr. Vijit KV, Ayurveda Neurology and Wellness Expert, our Chief Physician and Managing Director. He is the torch bearer of the 4th generation of Noble Traditional Ayurveda family, Kalladat Valappil. Dr. Vijit has a visionary with a sharp taste for innovation. He is solely responsible for bringing the idea of concept treatments and special preparations. Dr. Vijit is going to present this webinar, VIAMS Approach on Parkinson's Disease Management. Mr. Radish Manoharan, Director Operations, will give a brief about our organization. Dr. Sharanya Ravindran, Resident Medical Officer at VIAMS, she will be handling our question and answer session. Dr. Needu Esjit, Director of VIAMS, she will be delivering the vote of thanks. Thank you very much. Over to Mr. Radish.
Namaste all. Myself Radish, and I'll be briefing about us today. Thank you, Dr. Revati, for the wonderful introduction. VIAMS is a healthcare organization based on Ayurveda with a vision of inspire well-being. So to become the destination of Ayurveda-based solution, our missions are reinstate well-being, sustain well-being, master well-being, assure well-being, and rejuvenate well-being. We are traditional, authentic, legacy Ayurveda enterprise with a history of rich and exceptional healthcare custom traversing 4 generations that follows 5,000 plus years of Ayurveda discipline. VIAMS originated as a Vaidyashala, later established as a clinic, and developed as a full-fledged hospital facility in early 21st century. We are nestled in the serene village of Palakkad district, Kerala, India. Our sheer passion for growing has given in a slew of new projects. We have expanded our hands to an in-house ISO certified pharmaceutical firm, KV's Pharmacy, in the year 1996, one of the leading Ayurvedic medicine manufacturer in Kerala. KV's Pharmacy is certified with GMP, which is a system for ensuring that products are consistently produced and controlled according to the quality standards. Our undying desire to expand has led to Mitra Ayushpa in 2018, other subsidiary of VIAMS, adding more enthusiasm to human life and existence. We are placing our legs into new world of Ayurveda education, which is VIAMS Academy in 2020. We at VIAMS essentially focus on neurological conditions, especially Parkinson's disease. And we furthermore broaden our expertise in infertility treatment, women wellness, spine and joint care, lifestyle disorders and skin care, etc. VIAMS offers integrated treatment protocol which combines Ayurvedic science with physiotherapy, psychology, audiology, speech therapy, dietetics, yoga, and meditation. The custom tailored and specific treatments offered here at VIAMS are class by itself and have been the key factor to its success and prosperity, and which helps lead society a healthy and peaceful life with Ayurveda. Dr. Vijit will explain our approach on Parkinson's disease management today. Please be informed that there will be a Q&A session where we will answer your queries. Type your queries in the chat box or the comment box if you are on live on Facebook, which come in our mind in between the session, and that will be addressed in the Q&A session. Thank you everyone once again joining with us. Dr. Vijit, please take care of this today's session. Thank you.
Thank you, Mr. Ratish Manoharan, for the wonderful introduction about our institution, and thank you, Dr. Revati, for welcoming. So, namaste, good evening, those who have joined from India, and good afternoon and good morning, those who have joined from other time zones. Okay, so this webinar will be approximately 45 to 50 minutes of time, and I'll be detailing about the approach, our approach, the VIAMS approach in the management of Parkinson's disease. As Dr. Revati mentioned the importance of today, the April 11th, the World Parkinson's Day. In 1867, Dr. James Parkinson is a great doctor from London. He submitted a medical theory on shaking palsy, and later after his death, on his remembrance, this shaking palsy was rebranded or renamed as Parkinson's disease. So let's see what's our approach in Parkinson's disease. What is Parkinson's disease? Parkinson's disease is a progressive, irreversible, degenerative disorder of central nervous system affecting the motor, cognitive, and sensory functions. So, VIAMS, as an Ayurvedic institute, VIAMS correlates this Parkinson's disease to Kambavada in Ayurveda. Ayurveda envisions the human body as a congregation of three basic humors, namely Vata, Pitta, and Kapha. Vata is the entity concerned mainly with the control and coordination of our body by maintaining all kinds of movements and thought processes. Aggravation of certain qualities of Vata presents as tremors, imbalance, cognitive impairments, etc. Thus, correlate Parkinson's disease to such an exaggerated condition of Vata called Kambavada. Now, let us see how Kambavada is mentioned in Ayurvedic text. Approximately 16th century AD, there was an Ayurvedic classical text known as Basavarajya. In the 6th chapter of Basavarajya, it is clearly mentioned that Kambavada, Karapada Tale Kambe, Deha Brahmana Dukkide, Nidra Bango Madikshena, Kambavadasya Lakshana. This is a Sanskrit sloga in that text. Shivering of the palm and soul, vertigo, severe grief, loss of sleep, reduced confidence are the symptoms of Kambavada. Kambavada is not only mentioned in Basavarajya, but also the Parkinson disease notations in Ayurveda Samhitas, Vepatu, Kamba has been mentioned even in Rig Veda. Then Charaka Samhita, Susruta Samhita, Ashtanga Hridaya, Ashtanga Samgraha, Madhava Nidanam, Harita Samhita, Vangasena Samhita, Chakradatta, Sharangadara Samhita, Baba Pragasha, Vaishjaratnavali. In so many texts, this Kambavada, its signs, symptoms was mentioned very clearly. Now let's see how this Parkinson's disease occurs. Well, progressive degeneration of substantia nigra is the main cause. And this substantia nigra is a region of the midbrain where dopamine is produced. Dopamine is a neurotransmitter, and approximately there are more than 40 neurotransmitters in a human body, and one of the main neurotransmitter is dopamine, which plays a key role in the execution of motor and cognitive functions of human body. Dropping down in dopamine leads to cardinal symptoms like tremor, bradykinesia, and postural instability. Now, shall I ask you, are we at risk? Certainly not, but yes. Have a look into it. Do you know approximately 1% of the people above 60 years of age suffer from Parkinson's disease globally? Incidence doubles by the age of neurodegenerative disorders. Second largest cause of neurodegenerative disorders is Parkinson's disease. And recent observation shows a growing number of younger people, younger than 50 years of age, are being diagnosed with Parkinson's disease, which comes around 8 million of global population, and in 5% of cases characterized by an earlier age of onset, even though we can control Parkinson's disease. Now, let's discuss what would be the Nidana. Nidana means the causes of Kambavada or Parkinson's disease. Affecting Uttamanga, that is Abhyantara Marma Abhigada. That means, Marma means the vital parts of our body. So, if we have a trauma or a Abhigada in that vital parts, that may lead to Parkinson's disease. Then, Mithyahara Viharas, improper food habits and lifestyle habits. Nowadays, it's uncontrollable. Then the concept of Dushivisha, that is the overexposure to pesticides, preservatives, coloring agents, drugs, what we are using. Then Janavadodvamsa, the pandemic or epidemic situations or diseases. Role of pollution, that is the air pollution, water, and soil. And we can categorize the Parkinson's disease causes as hereditary, drug-induced, traumatic chemical interactions, accelerated aging, idiopathy. In hereditary Parkinson's disease can run in families as a result of the faulty genes being passed to a child by their parents. I'll be more specific. Our possibilities are more to have Parkinson's disease in case if the parents, grandparents, siblings, or any blood relatives have any type of neurodegenerative diseases or neurological problems, especially Parkinson's disease, progressive supranuclear palsy, motor neuron disorders, amyotrophic lateral sclerosis, dystonias, dementia, Alzheimer's, mentally retarded, etc. We have an experience of treating 3 generations of Parkinson's disease. Then coming to the drug-induced, those who have a history of taking medicines for more than for an year or more, mainly for neuropsychiatric problems, respiratory issues, asthma-like problems, gut-related problems, skin problems, may lead to Parkinson's disease. Now, The traumatic, any history of RT means road traffic accidents, any impact, any injuries on the head. Internal injuries in the brain, especially repeated trauma on head. Like we had seen boxing, then football matches. The very well-known boxing master, Mr. Muhammad Ali, suffered from Parkinson's disease in his last days. And that may lead to traumatic Parkinson's disease and is known as vascular Parkinsonism. Now the chemical interactions. Those who interact with chemicals, toxins, fertilizers, pesticides, overexposure to hot and cold climate may lead to Parkinson's disease. Accelerated aging. Those who have the history of surgical interventions like hysterectomy, hormonal therapies, chromosomal abnormalities, etc., may cause accelerated aging that leads to Parkinson's disease. Now, let's think, what is idiopathic Parkinson's, IPD? As the name says, we couldn't find any clue which leads to Parkinson's, and those type of Parkinson's disease will come under idiopathic Parkinson's disease. Now the most interesting thing, what are the signs and symptoms of the Parkinson's disease? Okay, let us categorize these main signs and symptoms of this Parkinson's disease into three: the motor functions, the cognitive functions, and the sensory functions. So the motor functions means those related to any movements in our body will come under motor functions. And those signs and symptoms related to conscious intellectual activity, such as thinking, remembering, or reasoning, may lead to cognitive problems. And those related signs and symptoms related to sensation, conveying nerve impulses from the sense organs to nerve centers, are listed under sensory functions. I will detail in the coming slides. Now, let me start with the motor symptoms, or the cardinal symptoms of Parkinson's disease. The cardinal symptoms of Parkinson's disease are in short known as TRAP, T-R-A-P. T represents for tremor, R for rigidity or stiffness, A for akinesia, and P for postural instability. So let's start with the tremor. Tremor, there are different types of tremor: rest tremor, kinetic tremor, pill rolling tremor, essential tremor, etc. The tremors in hands or arms or legs, when they are at rest, when the muscles are relaxed, the rest tremor occurs. Tremors occurs with a single task like writing. Usage of gadgets, trying to hold small objects, are known as kinetic tremors. This may aggravate by mental stress also. Then the next is pill rolling tremor. Tremors refers to finger, usually the thumb, the other fingers, that makes it looks as if a person is rolling a pill in the fingers. And the next, last type of tremor is essential tremor, that is involuntary or rhythmic shaking, which can affect any part of the body. Rigidity or stiffness. The elasticity of the muscles become reduced is known as rigidity or stiffness. Then akinesia, loss of ability to move muscles involuntarily, that is akinesia, and the slowness of movement is bradykinesia. The last motor symptom, the last cardinal motor symptom is postural instability. The patient may not have the proper alignment of the body parts, which may affect the performance of the work. We can say more than 100 or 150 signs and symptoms of in Parkinson's disease. So these are the main motor symptoms, and some of the other motor symptoms commonly we see in a Parkinson patient is micrographia, that is the progression to progressively smaller handwriting. Hypomimia, that is the masked face, that is reduction or loss of facial expression. That means the affected person to fixed mask-like expression. Then dystonic movements, muscles contract involuntarily, causing repetitive or twisting movements. stooped posture. Body became less flexible and the muscles in the back became very weak. Then the fascinating gait, then dysphagia. Dysphagia means difficulty in swallowing. Then dysarthria, difficulty or unclear articulation of the speech. Then monotonous soft voice, absence of arm swing while walking. Then excessive drooling, as there is increased salivary production due to the infrequent swallowing movements. The signs and symptoms related to motor function are not limited to these. Aches and pain in body, muscle cramps, dressing difficulties, slipped chappals, bed rolling difficulties, etc. will come under these motor functions. Now coming to the cognitive symptoms commonly seen in Parkinson's disease. The main cognitive symptoms we see are depression, anxiety, apathy, psychosis. So as we all know, depression is a mood disorder that involves a persistent feeling of sadness and loss of interest. Anxiety. Anxiety is a normal and often healthy emotion. However, when a person regularly feels disappropriate levels of anxiety, it may become a medical disorder. Apathy, lack of interest. Psychosis, disorder characterized by thinking and emotions that indicate the person experiencing them has lost contact with reality. Then the disorders of intellectual function. It is characterized by slowing of thought and information processing. The common cognitive symptoms other than this are sleep disturbances, then restless leg syndrome, periodic limb movement, REM sleep behavior disorders, insomnia, excessive daytime somnolence, sleep disordered breathing, daytime drowsiness, tiredness, fearful dreams, hallucinations. Hallucinations, they are the sensory experiences that appear real but are created by your mind. Loud noises during sleep, confusions, depressions, and even dementia will come under the cognitive symptoms of Parkinson's disease. Now coming to the sensory symptoms of this Parkinson's disease. In most cases, where brain has trouble receiving and responding to information that comes in through the senses, which comes under sensory symptoms, and mostly affected to our eyesight, known as diplopia, that is double vision, or delusion, that is imaginary vision. Then hearing, tinnitus, ear imbalance. Commonly, we all know about this vertigo, that is imbalance, ear imbalance. Then the smell, imaginary smell. Anosmia, complete loss of smell. Hyposmia, reduced ability of smell. Then touch, pain, pressure sensitivity, dysesthesia, that is abnormal sensation. Then the taste, impaired taste, means that your sense of taste is not functioning properly. Then hypogeusia, that is reduced ability to taste. And the common sensory symptoms include this urinary incontinence, hypotension, sexual problems, constipation, severe fatigue, frequent falls, incapacitation, aspiration, bruxism, seborrhea, weight loss, weight gain, etc. Now, coming to the most important part of this webinar, VIAMS objectives in the management or the treatment of Parkinson's disease. Our main objectives are arrest further degeneration. As we all know, this is a neurodegenerative disorder and the brain cells or the neurons get gradually degenerated. And as a result of that degeneration, the disease, the signs and symptoms will progress. So, initially, the most important, our objective is to arrest further degeneration of the brain cells and thereby improving the quality of life, the betterment of quality of life and betterment of daily activities. Regeneration of cells in possible cases. Regeneration of cells in possible cases. That means if the patient is below 50 years of age, we have a chance to regenerate the brain cells. Not possible in all cases. Then the next is longevity. By providing a good health, a better health, we can increase the longevity of the patient. Then improvement in social living. As we all know, Parkinson's disease is known as a socio-economic disaster. So we can improvise our social living. Then reducing the side effects of medicines what we are taking for the Parkinson's disease. That means reducing the side effects of the medicines. As we all know, the dopaminergic, while we take the mainly two types of drugs we are taking for this Parkinson's disease, that they are known as dopaminergic medicines, and they are known as dopamine antagonists. That means if you are taking this dopaminergic medicines, it will slow down the natural dopamine production, and they are known as dopamine antagonists. And the psychiatric medicines, what we are taking for the cognitive problems, and mainly beta blockers, causes drowsiness. So, by coming to the Ayurvedic medicines, we can reduce the side effects of those medicines. Now the objective is very clear. Now, what is our approach? How we are approaching this management of this Parkinson's disease? We can control or stop the progression of the disease by arresting further degeneration of the brain cells with our customized Ayurvedic medicines and therapies. Ayurvedic therapies contribute by stimulating muscular system, thus improving both fine and gross motor skills of the patient, thus slowing down further degeneration and providing quality of life. What is our uniqueness of the management of the Parkinson's disease? Authenticity in medicine, the most important thing. We are privileged to have a GMP and ISO certified medicine manufacturing unit, which enables us to make customized herbal combinations as per each patient's requirement. Then personalized customization of therapies. Therapies are molded to suit each patient and ailments. Then the most important is integration of allied health sciences in our institution. Traditional and personalized Ayurvedic treatment is incorporated with allied healthcare techniques like yoga, physiotherapy, psychotherapy, audiology, speech therapy, nutrition, dietetics, psychology counseling, occupational therapy, and so on. Then, faultless approach. We keep 360-degree focus on the patients and their symptoms, by which we can also manage all related conditions. Legacy, a rich and splendid healthcare tradition spanning 4 generations. So, the objective, approach, uniqueness. Now, the methodology, what we are following. Analysis. The first methodology is analysis. The second is investigations. Then differential diagnosis, the important one. Finally, the diagnosis. Then defining treatment protocol. So, integration of traditional and customized Ayurvedic treatment with allied healthcare techniques such as physiotherapy, psychology, audiology, speech therapy, dietetics, yoga, meditation, occupational therapy, etc. Customized herbal combination to have optimum result. Now, I would like to share more about the methodology of VIAMS. We start with the analysis of the patient with traditional and modern techniques. Then we do the differential diagnosis to ensure whether the patient had Parkinson's disease or any other neurodegenerative problems. We will then diagnose the neurological condition and then move to define the treatment protocol. So, the most important and effective analysis in Parkinson disease is the interaction with the patient, which states in Ayurveda as Darshana Sparshana Prashnehi Pariksheda Roginam Rogam Nidhana Pragruva Lakshano Ubasayaptibi, which is visual analysis, that is Darshana Pariksha, which includes the observation and inspecting a patient's skin, behavior, hair, eyes, tongue, etc. Then the next is physical analysis, that is the Sparshana Pariksha. Physical examinations such as Nadi Pariksha, pulse diagnostics, palpation, percussion, and auscultation. Then Prashna Pariksha, the question and answer session, where a patient is asked about the symptoms and medical history, lifestyle habits, and the other important factors preceding or associated with particular health problem. Now, investigations. Nowadays, our science has developed and investigations plays a key role in Parkinson's disease management. So, the common investigations available for the Parkinson's disease are definitely CT scan of brain, MRI of brain, then PET scan, positron emission tomography, that is a nuclear imaging technique, then levodopa scan, which binds to the dopamine transporter, could be used to image the dopaminergic system in diagnosis of Parkinson's disease. Then transcranial ultrasound. These are the investigations available. Then some blood reports like the common CBC, common blood count, then electrolytes, vitamin D and vitamin B12, LFT, RFT, TFT. Thyroid function test is very important. Then peripheral smear then serum ceruloplasmin, then liver biopsy, slit lamp examinations, EEG. These are all the general other investigations we are doing. And there are some red flags in Parkinson's diagnosis, that is early or prominent dementia. Then symmetrical signs, then bulbar dysfunction. Bulbar dysfunction means the speech abnormalities, then early gait disorders, falls within the first year, wheelchair dependence within 5 years, early autonomic failure, sleep apnea and excessive nightmares, gasping respirations, apraxia, cortical sensory loss, and MND features. And always be alert about digestion, that is Samyak Agni maintenance as per Ayurveda. Then Patya Ahara, ensure proper nutrition, a sattvic diet. Then ensure proper hydration. Then Samyak Sugha Nidra, 8 hours sleep in well ventilated room. Then Abana Anuloma, that is Malamutra Visarjana, and a constipated bowel is never acceptable. Now coming to the differential diagnosis. In differential diagnosis, we are discussing the possibilities of differential diagnosis. It includes Parkinson's disease, Parkinsonism, Alzheimer's, PSP, XDP, dystonia, MSA, multiple system atrophy, MND, motor neuron disorders, ALS, amyotrophic lateral sclerosis, different types of ataxia, cerebellar ataxia, then OPCA, oligopontocerebellar atrophy, dementia, chorea, tics, writer's cramp, so many. So according to the patient, we will discuss with the patient, and then we'll go to the, after the differential diagnosis, we will diagnose exactly what the condition is. Then whether the patient has 3 cardinal symptoms, we can confirm it as a typical Parkinson disease. So now defining the treatment protocol. The treatment protocol is individualized as per the condition and nature of the patient and progression of the disease. So the key treatment protocol includes internal medicines, external therapies, and allied healthcare techniques. The internal medicines includes decoctions, medicated oils, medicated ghee, then herbal powders, tablets, customized metal and mineral preparations, etc., aimed at improving nerve and muscle strength, cognitive abilities, as well as regeneration of atrophied cells. External therapies include the Panchakarma therapies meant for purification and regeneration. Panchakarma therapy will help to improve muscle strength, tone, bulk, as well as improving cognitive and sensory functions. Then integration of allied healthcare techniques at VIAMS in our institution. Traditional and personalized Ayurvedic treatments is incorporated with allied healthcare techniques. This yoga, physiotherapy, psychology, audiology, speech therapy, nutrition, and dietetics. And this advise or inform the patient the nature of the illness. Maintain good physical and mental health. Practice exercise regularly. Be active as much as possible. Take diets rich in fibers, rich in antioxidants, and rich in vitamins. Maintain Jadaragni Bala and thus Dhatvagni Bala. Ensure Vada Anulomanam, that is, avoid constipation. Removing abnormal protein accumulations by limiting protein intake. Blocking autoimmune triggers and avoid stress and anxiety. Now, coming to the integration. What is the role of this these allied health sciences? So, to start with physiotherapy, regular physical exercise can be beneficial to maintain and improve mobility, flexibility, strength, gait, and quality of life. Physiotherapy can help with the movement and balance problems. That includes aerobic exercises, balance training, gait training. Weighted tools can be used to avoid backward fall. Flexibility training, visual tracking, gaze training using prism lenses, and motor cognitive exercises. Now the role of the psychology. Our psychologist in our institution assesses the individuals to diagnose their cognitive, emotional, and behavioral disorders and treat using a variety of techniques including cognitive behavioral therapy, commonly known as CBT. They support the patient as well as their relatives. Here in our institution, we will give an individual counseling to the patient, then a caregiver counseling, and then a family counseling. A three-tier counseling technology is integrated in our treatment protocol. Now, the speech difficulty. Most of the persons, the people with Parkinson, PWP, will have the speech difficulty. So, our audiologist or the speech language pathologist, specialist assess, diagnose, and treat speech language, social communication, cognitive communication, swallowing difficulty, that is dysphagia, hearing and imbalance problems using assistive communication devices, and change the food consistency to correct the swallowing difficulties. Because if the food get into the lung, cause aspiration pneumonia. So the ASLP specialist helps to prevent this from happening. And the integration of nutrition and dietetics. We have observed that the absorption issues can be resolved with the help of a nutritionist. Dietitian assesses individual food and nutrient intake, their lifestyle, and medical history. Their advance can contribute to the improvement of Parkinson's disease symptoms and increase health-related quality of life. Planning of balanced diet based on periodical nutritional assessments is essential because Parkinson's disease patients present with gastrointestinal dysfunction leading to constipation and gastroparesis, that is food remaining in the stomach for a longer period than normal. Then diet planning is also needed to maintain nutritional levels by avoiding weight loss or gain. Integration of yoga and meditation. Yoga is a science gifted to the world by primordial Indian culture. Yoga aims to unify body and mind by combining respirational and physical exercises. Yoga enhances body movements, cognitive and behavioral problems. More than being a mere exercise regimen, yoga aims to coordinate bodily functions with that of the mind. Various yoga techniques helps in maintaining peace, confidence and happiness to the mind while helping to increase flexibility, reduce muscle spasms and ultimately leading to an improved quality of life. Each soul is potentially divine. The goal is to manifest divinity within by controlling nature, external and internal. Do it either by work of worship, psychic control or philosophy, by one or more or all of these, and to be free. The systemic methodology of unfoldment of this inner potential divinity by moving towards self-perfection is referred to as yoga. A yoga session mainly comprises of breathing exercises, meditation, and yogasana that stretch and strengthen various muscle groups. The benefit of yoga includes flexibility of muscles, corrects the posture and alignment of the body, renders better digestive system, strengthens internal organs, helps in skin glow, promotes strength and stamina, improves concentration, helps in mind and thought control, keeps mind calm by overcoming anxiety, stress and depression, helps in releasing mental tension, helps in blood circulation and muscle relaxation, etc. That's all about the yoga. Now, can we mitigate the mitigation or the management as the VIAMS method? Alleviation of exaggerated doshas with customized internal medications or formulations and cleaning the body with Panchakarma therapy, the Shodhana therapy. That means the complete purification and removal of toxic substances from all of the dhadus. Improving the core muscular functioning and imbalance through physiotherapy. Psychology counseling assesses and treat emotional, cognitive and behavioral problems. The ASLP specialist assesses and treat persons' speech, language and hearing problems, rekindling the vigor of the body and mind through yoga and meditation. Parkinson's disease cannot be prevented, but the progression of the disease can be halted. Some of the measures to stop the disease progression include lifestyle modifications like be active as possible, dietary modifications, that is, use all rice, wheat, citrus, fruit, vegetables, nuts, milk and milk products, pomegranate, lemon, mango, orange, guava, apple, peach, garlic, asafoetida, sprout, etc. Avoid barley, aracanine, jamun, excess protein diet, hot, spicy food, and incompatible food articles. People who eat more fruits and vegetables, high fiber foods, fish, omega-3 rich oils, and who eat less red meat and dairy may have some protection against the Parkinson's disease. Antioxidants such as vitamin C and D are protective against the disease. Consumption of more vitamin B12 would help people battling Parkinson's. Calcium and vitamin D supplements help for bone health as the Parkinson's disease patients have an elevated risk of developing fragile bones and fractures. Practice regular aerobic exercises. This is the most important thing. Physical exercises is the most important thing in a Parkinson's disease patient. Then reduction of stress through yoga and meditation. Environment modifications like avoiding exposure to harmful chemicals either at home or work. consume antipsychotics or any other medication under close supervision of your doctor. Now, coming to the conclusion of this webinar. Parkinson disease is a disorder with no established cure. Ayurveda has shown that it has a better success rate than other systems of medicine when dealing with any degenerative disorders. I repeat, Ayurveda has shown that it has a better success rate than other systems of medicine when dealing with any degenerative disorders. Similarly, it is considerable potential in dealing with neurodegenerative disorders is yet to be properly tapped. Parkinson's disease does not affect the lifespan of the patient, but it affects the quality of life. Parkinson's disease patients' family members give extra help and support to stay and preserve their quality of life. At VIAMS, we aim to properly treat and document each of these cases with the ultimate aim of bringing Ayurveda into mainstream medical discussions. Yes, we can control Parkinson's.
I want to express my sincere thanks to Team VIAMS for arranging this webinar successfully. Special mention to Dr. Vijit KV, Managing Director and Chief Physician of VIAMS, to present a great session about VIAMS' approach on Parkinson's disease management. He is the backbone of our institution and the guiding force for every step forward. Last but not least, I thank to Mr. Ratish Manoharan, our Director Operations, and our doctors team, Dr. Revati and Dr. Sharanya. Without you, this webinar would not be a success. Thank you, buddies. Once again, thanks to all who were directly or indirectly helped to make the webinar successful. Sarve Sandhu Niramya. Let all be healthy.